Inflammation has three different phases to it. The first phase is acute. That is onset of injury up to about 3 days. Subacute is about day 4 to 14, and then chronic is day 14 and on. Now, there is some flexibility there, so acute inflammation can last longer than 3 days. It could be 5 days, 6 days. Depends on the severity of the injury and the nature of what's going on. The three phases of inflammation will dictate how you treat the patient. Typically, your acute, you're going to do your RICE protocol, which is rest, ice, compression, elevation. Ice is a very good mechanical anti-inflammatory. Subacute, you can start to introduce movement, and you're still doing icing, and at some point you can start to introduce heat. And then in chronic, certainly you can begin more aggressive movements and treatments and therapies and heat and so forth. Okay, another thing about inflammation overall that I really want you to never forget is that chronic inflammation is not your friend. It will hurt you. It's devastating, causes lots and lots of problems. So you want to do the best you can to avoid chronic inflammation. Okay, these are some of the things that can cause inflammation and chronic inflammation, where it's constantly there. So inflammation occurs when tissue is damaged. Okay, now there are inflammatory mediators that come in. I get into those in detail in ANP2 in our immune system lecture. I'll get into the inflammatory mediators and the different chemicals that are released and what each one does, which ones are responsible for our immune system and bringing in these Pac-Mans to protect you, and on it goes. So we get into more detail in my ANP2 class. But for right now, just know we have inflammatory mediators that come into the site when tissue is damaged. And there are different things that can cause tissue damage. Viral infections, bacteria infections, pro-inflammatory diets, cuts and other injuries, subluxation patterns. This is a fancy word for a misalignment in the joint. It doesn't matter what joint. Any joint can sublux. So you have perfect alignment, and then you have dislocation, but in between them is a subluxation. So it's not in perfect alignment, and it's not dislocated, it's subluxed. And that sublux joint is aberrant movement. It is uncomfortable. It can hurt. People can guard, they limp, they have associated back pain or neck pain or shoulder pain or wrist pain, wherever the sublux is occurring. That's the site that you're going to have muscle guarding, muscle spasms, limited range of motion, painful range of motion, and on it goes. Okay, and that will depend on the severity, is going to depend to the degree. And this is where most people live. They just put up with the joint pain. Well, over time, that abnormal joint movement, which is an inflammatory response, can lead to osteoarthritis and other degeneration and other issues, abnormal biomechanics and so forth. Microorganisms can cause inflammation. And this is a big part of my practice. I'm obviously a big fan of an anti-inflammatory life. And to some degree, I can, we're always going to battle inflammation, and we're going to get sick, we're going to get stressed, things are going to happen. But I also think that you can, once you become aware of these things, you can limit the amount of inflammation, and the more you can limit it, the better off you're going to be in the long run. And in one of the first lecture videos you saw about how to have a successful semester, I incorporated in there some healthy habits and that kind of thing that you can apply. But some big ones, if not the most important, is just diet and lifestyle. Having a anti-inflammatory diet, stress management, healthy rounds of exercise, and so on. Okay, when inflammation occurs, you get these inflammatory mediators or chemical mediators that come in, such as histamines, kinins, prostaglandins, leukotrienes. The blood vessels will dilate, and that dilation is what causes the redness. It can cause heat production. Edema, which is swelling, takes place. That is a lymphatic and tissue injury mechanism, and it goes into the interstitial space. But edema is at first there to protect you. Okay, so acute inflammation is designed to protect you. You roll your ankle, it's gonna swell, it's gonna hurt. And the reason your body does that is so that hopefully you won't walk on it, because the continual walking or whatever will just continue the tissue damage. So your body has built-in protective mechanisms. Swelling is one of them. Fibrin will come in. Fibrin is a type of protein that starts to wall off the site of the injury. Acute inflammation and edema and some other mechanisms can also help prevent the spread of infection. That's important. So the early phases of inflammation are good. They're there to protect you. It's the harmful ones that the harmful one is the chronic inflammation that can hurt you over time. This one here, adhesions. When you get an injury, whether it's repetitive motion injury or more of a macro trauma injury, like a rolled ankle, a dislocated shoulder, pulled hamstring, whatever, adhesions are going to form. Okay, now we want the tissue to repair, so you're going to get some scar tissue, you're going to get some adhesions, but the key is to have someone manipulate the tissue so that the adhesions form correctly. They form in the orientation of the joint plane line, they form as they follow the muscle fibers, so because that makes the area, the muscle, the tissue, and the joint more functional, because now you have healthy scar tissue that is laid down versus unhealthy irregular scar tissue. Now that's a big part of my practice, a big part of what I do. This is a more of a manipulation, adjustment, PT, rehab, sports medicine type thing. Very important to get the hurt areas treated properly so that you have proper healing, so that down the road, when you're going to do your activity, your sport, your whatever, the integrity is stronger than had you not done anything. For example, ever know someone, maybe this is you, that rolled an ankle, didn't really do rehab, didn't really do much, they braced it, kind of stayed off of it, maybe did crutches, maybe a boot, and then after 3, 4, 5 weeks or whatever, they just kind of go back to walking again. And then they roll it again. And now they have chronic, reoccurring ankle sprains. And it becomes easier and easier and easier for them to sprain them. Why? Well, because they didn't get the proper treatment to begin with. Okay. Neutrophils are a type of Pac-Man, and they are a white blood cell, so that's what this is. WBC is a white blood cell. Its job is to fight bacteria and other antigens. Antigen is basically a foreign invader that doesn't belong in your body, like bacteria. Macrophages, I'm going to draw a big Pac-Man because macrophages are big eaters. They are a larger type of white blood cell. So they'll come in and clean up all the debris. So neutrophils go into the site. They literally eat themselves to death, defending you, eating bacteria, eating microorganisms. At some point, the neutrophils die doing their job. Now you've got all these dead good guys and bad guys. Well, the macrophages come in and clean all that stuff up. Okay, now a byproduct of that can be pus. So sometimes, like if you get a splinter, for example, you can notice that some pus is starting to develop within the wound. Those are some byproducts from the breakdown of the neutrophils and the dead and dying bacteria and so forth. Okay, here we're seeing the skin is getting a puncture wound, so a splinter. Anytime you puncture skin, there's a very, very high chance you're introducing bacteria from the external environment to the internal environment. So you're introducing these microorganisms. The presence of those microorganisms sends a signal out called chemotaxis that signals your Pac-Mans to come to the site and start doing their job. That's how they know to get there. So your order with inflammation and injuries and so forth, like in this example, you would want to remove the harmful stimulus, so take the splinter out. If it's an aberrant joint, a sublux joint, correct it. That's removing the interference. If you're eating foods that are hurting you, stop. If you're putting lotions and creams that's causing you to break out and allergic reactions and so forth, remove it. So the point is, remove the interference, remove the provocative item. In this case, it's a splinter. Okay, then do your cleaning process. So clean the injury out, clean the tissue and all that. And then you can do your RICE protocols, rest, ice, compression, elevation, or wound care, whatever adjustments, the rehab, whatever the work is necessary depending on the injury. Remove the interference and then do the necessary treatments so that the body can begin to heal properly. If you take NSAIDs or a chemical anti-inflammatory, it will do its job. It will, likely decrease pain, decrease inflammation, but don't forget about the side effects. Okay, every drug has its own side effects, so just keep in mind that. And my personal bias is just be smart about it. For me to take any kind of pain meds, it has to be pretty stinking bad. Otherwise, I just live with it. While I go through the different phases of healing. And I do that on purpose because I want to feel and see how my body's doing. I don't want to mask things. So I do the best I can to not take medication. Now, everybody's different. Some people are weenies and, fly lands on them like, oh my gosh, this is the most painful thing, and they want hydrocodone and a lot of it. And then the other end of the scale, some pretty banged up, nasty injuries, and you're kind of like, do you want pain meds? Like, no. It's like, okay, that's kind of impressive. So I get it. Everybody's different. Everyone's threshold of pain is different. But do the best you can to try not to, and if you absolutely have to, with yourself or your future patients, just educate them, especially on the side effects. Histamine release if you get a histamine release, that typically means you're gonna get some sort of an allergic reaction. So then people will take antihistamines, and what an antihistamine medication does is it blocks the receptor site for the histamine binding site. So if a histamine cannot bind to the cell, then you're not going to get the allergic response. So that's what an antihistamine does. Ibuprofen, naproxen, anti-inflammatory drugs, they do prevent the synthesis of prostaglandins, which, when you follow your cascade of events with anti-inflammatory chemicals, the end result with your COX-2 inhibitors and prostaglandin inhibitors and all that is it decreases inflammation. Okay, we have the wound healing. So once you get a fresh wound and then you remove it, the body can begin to heal. So in the second phase here, now keep in mind your neutrophils and macrophages and all that are cleaning up the debris and killing the bacteria and all that. Fibroblasts, which is the type of scar tissue, they'll start to come in and heal, start to repair. And in the third phase, you're going to start to get granulation, which is basically a thicker type of scar tissue that's coming in to really wall off and protect as the tissue is continuing to heal. And in the fourth phase, the granule tissue is being replaced by connective tissue through connective tissue synthesis. And notice this time here, 1 month. So when I visit with new patients that come into my clinic, I do really try to get them to focus on the classic 4 to 6 week mindset of getting better. If you get hurt, neuromusculoskeletal stuff, whatever, you just don't heal in 5 seconds. It just doesn't happen. The human body can only heal so quickly. So there's different phases of healing, and if we can get them to commit to 4 to 6 weeks, we've got a very, very high chance of success of getting them better. Okay, chronic inflammation happens when the agent responsible for the injury is not removed. Okay, earlier I mentioned make sure you remove the harmful thing, whether it's a splinter or whatever, food, because it interferes with the process of healing. So in this example, we're going to go over if the lungs are exposed to silica, which is sand, for long enough, then normal tissue is replaced by fibrous connective tissue, silicosis. Okay, now this person is at risk for respiratory dysfunction like tuberculosis, okay, because they have a suppressed immune system, and if TB is around in the air, they breathe it in, whatever, they can get it. Okay, this is an x-ray. You're seeing the thoracic spine here. Okay, here's rib 1, there's rib 2. You're looking at a granuloma, and that's fibroblasts and collagen that has walled off the antigen, the foreign particle that got into the lungs. Here, here's your chest x-ray. You can see the ribs. Okay, so there's a bunch of ribs on both sides. There's your clavicle. And here's heart. Okay. So it's just giving you an idea, an orientation of what you're looking at. You can see a bunch of white splotchy dots within that lung field here. Okay. All that stuff there is granulomas and fibrous sacs and all that from, this is what tuberculosis scar looks like. So when you take an x-ray to look for TB, that's what you're going to find. Okay, this one just talks about how the adjustments and manipulations really help to break through the adhesions and lay down new collagen. And this statement here, collagen fibers become more irregular in structure. As a consequence, connective tissue with abundant collagen such as tendons and ligaments become less flexible, so you're starting to lose integrity, and more fragile, more susceptible to injury. Elastic fibers fragment, okay, so you get this fragmentation, and bind to calcium. Keep in mind, calcium is always recruited with macro and micro trauma. You're always going to get calcium come into the scene. So now the tissue becomes less elastic, so the integrity is going down. So consequently, elastic connective tissue, ligaments, and all that become less elastic, and you get reduction in flexibility and elasticity. One of the side effects can be an increase in wrinkling of skin, tendency for bones to break, muscles can tear, re-tear, your tendons, muscles, and ligaments can experience the sprain strains. Walls of arteries can become less elastic, leading to turbulent flow and other blood vessel disorders. That's something we really hit hard in ANP2 when we look at blood vessels and what happens when the tunica intima, which is the inside lining of the blood vessel, starts to tear, and where plaque formation comes from and all that. And these changes in collagen elastic fibers can lead to this atherosclerosis, which is a blood vessel problem. And then the plaque forms. And by the way, this is not because of cholesterol, and this is not because you're statin deficient. This is because of inflammation. Inflammation, harmful substances, adhesions, macro and micronutrient deficiencies leading to poor integrity of tissue and so forth. That is what is creating damage, and then the body comes in to try and repair it. So in this example with plaque formation that develops between the tunica intima and the tunica media in a blood vessel, yeah, you're going to get some plaque, but that is all a side effect of the body doing its job to try to wall off and protect. So no matter how much statin drugs you are, this is going to happen. So the best thing to do is to control the inflammation. Remove the thing and things that are hurting you. So because the blood vessel walls are getting hurt, lipid formation, calcium deposits, and on it goes. And yeah, you're going to get some damage. This can lead to atherosclerosis. It can lead to arteriosclerosis, cardiovascular heart disease, blood clots, thrombus, myocardial infarctions. And then if it gets bad enough, you can actually start to hurt the arteries, aneurysms, aggressive tears, and so forth. Okay, our patient here, Miss B, was proud of her tan. She worked her whole life basically spending as much time in the sun as possible. One day she notices a black irregular looking mole. Okay, key, black irregular. So those of you going to be doing exams one day, especially dermatology stuff, I mean, for the most part, a mole is a mole, and they're not harmful. But then all of a sudden you get this darker than usual, irregular, funny looking mole. It's like, that doesn't look right. Okay, listen to that intuition. It's also tender and it's ulcerating, which means it's oozing fluid. Okay, definitely not good. So she goes to a medical doc and they decide to do a biopsy. That is where you extract tissue for getting it analyzed. And the results come back that it was a malignant melanoma, which is the more aggressive form of tumors. Okay, a tumor is simply a growth of something. A neoplastic growth, it's just new tissues growing because of abnormal cell division. The question is it benign or is it malignant if you get a tumor or neoplastic growth? The sun's UV rays create oxidative damage, and then the body responds by deepening and darkening the skin pigment. Fibrons are broken in the skin. This creates oxidative damage and free radical formation. And then this will lead to abnormal tissue growth, which can lead to a tumor. So this neoplasm is either going to be malignant or benign. The malignant is the bad one in the neoplasm world, and benign is typically not a bad one. It's a growth, it's a tumor, but not necessarily bad. However, the increasing size of the benign tumor can start to press on sensitive structures, which can cause problems and disrupt other tissue. So now this would be considered cancer. So cancer is, especially on the malignant side. And the other thing that you're worried about is the cancer metastasizing. And if that happens, that means it's spread. The cancer is now spreading to other areas of the body, and it's usually spread through the lymphatic system and your blood vessel system. Every human does have cancer cells. That's why we rely on our immune system to take care of them for us. And of course, as a bias of mine, I think it's extremely important to constantly keep your immune system healthy. And, a lot of Americans, a lot of people wake up in the morning and they're just like, in all honesty, they're like, what can I do today to suppress my immune system? And then they do it. From the excessive amounts of soft drinks and sugar and the stress and poor diets and on it goes, they just simply suppress their immune system. And day after day, year after year, this adds up. And so that does mean you lose the ability to fight cancer, to fight, whatever it is. So now you succumb to it, okay? And yes, I know what some of you are thinking, what about genetics and what about some, exposure to radiation, and I get that. There's a lot of variables that go into ailments and cancer and, other health issues and so forth. I get that. So either way, whether you're genetically susceptible to things or not, one thing that you can control is diet and lifestyle, environmental factors. So just do the best you can to maintain a healthy immune system by boosting your immune system through diet, through exercise and stress management, adjustments, anything in the physical therapy rehab world. Physicals are great. Get some updates from time to time. What is your blood chemistry saying? Are things out of range? This is once a malignancy does set in, now with the American cancer model, you're going to have to go through cancer therapy. So radiation, laser treatment, surgery, chemo, other drugs, and all that to try to kill these cancer cells. Oncology is the specialty that studies and treats cancer. In my clinic, in my practice, I have caught cancer. I was the first one to see it. People come in with pain and so forth, take an x-ray, and it's like, wow, looking at the films, it's like, that's definitely cancer. That is not good. So I end up referring them to oncology and letting them take over the case.